We have two injuries in the brachial plexus. One injury is if we have a lesion to the upper trunk, and another injury if we have a lesion or problem with the lower trunk. The first thing we need to understand what happens and how can we get that injury. The upper trunk, you guys, happens when there is a fall on the shoulder and there is excessive extension on the head during the fall, and it can also happen during delivery of the baby if there is excessive lateral traction of the head of the baby, injuring the upper trunk. Now, what happens if we have problem with the upper trunk or superior trunk? I just want you to remember the waiter's tip arm or his hand or upper limb. All right, so the waiter's tip, this is how the waiter is keeping his other arm. Okay, so think about his arm. Put your hand now into this position. Explain to me what is happening. This is the position of the legioned person. Once you put your hand in this, you know that the opposite of this is not working. So what are you basically doing when you are in the exam and you have an question about the Erb's paralysis? You will remember your waiter's tip. You're going to put your hand in that position and you will tell me, what do you have? All right, my shoulder is adducted. All right, so it means the abduction is not working. Yes, so which muscles are affected? Remember from the previous videos, you have the supraspinatus that initiates the abduction, which is the start of the abduction in the first 15 to 30 degrees. And then you have the deltoid that takes your arm all the way up. So in that, because your arm now is adducted and medially rotated, you don't have abduction, which means that you have a problem with the supraspinatus and deltoid. What about the rotation of your shoulder? The shoulder is internally rotated or medially rotated. It means the external rotators are not working. Who are the external rotators? Your SIT muscles, your sit muscles. Remember the supraspinatus, infraspinatus, and teres minor? So these muscles are not working. Great. What happens to your elbow? I have extended elbow. What does that mean? It's actually extended. So sorry about the waiter's tip. He's flexing his elbow here, but put your hand in that position and explain to me this. You have extension in the elbow. So what is your problem? Your elbow flexors are not working. Which are your elbow flexors? Your biceps muscle, brachialis, coracobrachialis. All right. So these muscles are not working. All right. Now, what about your radioulnar joint? Your forearm is pronated. What does that mean? It means the supinator muscle is not working. All right. What about your wrist joint? Your wrist joint is flexed. It means your extensors are not working. All right. So in that case, you will be able to tell what muscles are not working. All right. All right, so that way you will know what happens in your arm. So you don't need to memorize. Your superior trunk gives rise to important nerves. You know them by now. I'm sure if you try to think about how the upper trunk or superior trunk is trying to contribute to those guys, you will know. You will write the nerve and you will be able to tell which part exactly is affected, because the upper trunk has C5 and C7. So C5 and C7 is involved in all of the motions that are opposite to these. All right, so if I lose the opposite, that will put me in these positions. So just put your hand like that, explain that, and you're ready to answer any exam question related to the Erb's paralysis. All right, now before we talk about the lower trunk, and because the Klumpke's paralysis is coming a bit earlier, which should be explained after you understand the muscles of the forearm and hand, I just want to give you a small concept that will be covered again in the forearm and hand, because I want you to understand them so that the Klumpke's paralysis becomes a topic that you explain it by understanding it, not memorization. I don't want you guys to memorize. So what is the information I'm going to tell here? I just want you guys to know that your ulnar nerve and median nerve are going to take care of all of the muscles in the anterior aspect of the forearm and hand. So anterior, we have nerves traveling with us down. These muscles are median, ulnar, and radial. The radial nerve is going to take care of everything at the back, and the median and ulnar are going to take care of the anterior forearm and hand. I'm not going to talk about all of the muscles. We're going to explain them when we get to that region. I'm going to help you on how to remember them perfectly in exam when we come to that topic. But now I just want to mention one thing. What happens is the median and ulnar nerve are coming in the front here, and they want to supply structures in the front and structures in the front of the hand. The idea here is median nerve is going to supply all of the muscles in the frontal aspect of the forearm except the ulnar nerve, guys, and during its journey, all right, the ulnar nerve will come and it will run between the flexor digitorum profundus muscle. We have a muscle called flexor digitorum profundus. I didn't know that this is superficialis. I thought this is a picture of profundus. This is okay, fine. But I just want to talk about the profundus. The ulnar nerve will come here then. It's not gonna go there. Okay. So the ulnar nerve is going to run this way, and it's gonna run between the profundus and another muscle called flexor carpi ulnaris. All right. So since this nerve is running between them, so it will want to supply both. So the ulnar nerve supplies in the forearm region only two muscles, the flexor digitorum profundus, the lateral part of it. I'm sorry, I'm just considering superficialis as profundus because this is the only muscle I have it here. So the profundus, it has two parts, medial part here towards your body and lateral part. So because it runs between the medial head or medial part of it and the flexor carpi ulnaris muscle, all right, ulnaris muscle. So the ulnar nerve, ulnar nerve is going to supply them both. Now, why am I mentioning that? Because I want you to know one thing, guys. The flexor digitorum profundus muscle, it will end up in the hand as tendons. We will have tendons going to all digits. Out of these tendons, we will have the origin of the lumbricals muscle, which is something that is very interesting because this is a muscle that takes its origin from tendons, not a bone. Why am I also mentioning that? Because I want you guys to things to make sense for you, that if your medial part of the muscle is supplied by ulnar nerve, and I'm telling you that we have lumbricals coming out of its tendons, the profundus, then you have two muscles here to these two fingers, and you have two lumbricals muscles to these two fingers. All right, how do we give numbers to the muscles? This is number one. Okay, this is one, this is two, this is three, this is four, and this is five. Now, if I'm telling you that you have two parts of the profundus muscle, the medial part is supplied by ulnar nerve. So the medial two lumbricals are supplied also by ulnar nerve. Now, what about the lateral two lumbricals? It is supplied by the median nerve. So the lateral two are supplied by median nerve. So now it makes sense that the medial two lumbricals and the medial part of profundus are supplied by ulnar nerve, and everything else is supplied by median nerve. I'm talking about the forearm. And we're going to talk about the deep muscles of the hand later on. I just want you to remember that information about the lumbricals. So the lumbricals is supplied by both median and ulnar. And if you guys look at a picture of a real cadaver, you will see how the tendons of profunda, flexor digitorum profundus, are coming here, and how the lumbricals are coming from the side of it to give you 1, 2 lumbricals, and these two are supplied by median nerve, and 3, 4, these two are supplied by ulnar nerve. All right. Someone will tell me it's difficult to remember. All right, I will tell you another hint, which is a bit early because I like to say it when we come to the hand. You can put your hand like that. With these three fingers, you will make an M letter. And with these two fingers, you can do a U letter, which is ulna. Another thing, your ulna is here, guys. So this part is taken care of by the ulnar nerve. So that makes sense that third and fourth lumbricals and the medial part of flexor digitorum profundus are supplied by the U, ulnar nerve, and the lateral guys are supplied by median nerve. All right? So by now, you're not memorizing anything. Everything makes sense. You have four lumbricals, medial 2 and lateral 2. The lateral 2 are number 2 and 3 lumbricals, 2 muscles. And the medial, second and third fingers, not second and third lumbricals, because we have only 4 lumbricals. The thumb is out. It has its own muscles. So if we want to name the lumbricals will be named as 1, 2, 3, 4, because this is how the exam question will come. They will tell you the lumbrical muscle number 2 is supplied by which nerve. You need to put your hand in that position. Remember that this is the M laterally, and medially you have the U, but out of these, we're talking about the fingers. We're gonna give the names lateral to medial, 1, 2, 3, 4. The first and second lumbricals supplied by median nerve. The third and fourth lumbricals supplied by ulnar nerve. All right, so just put your hand in this position. Remember that the U letter comes to the 2 fingers that are facing the ulna, so they are third and fourth lumbricals supplied by ulnar, and the first and second are supplied by median nerve. All right, so why do we need to know that? Because the injury should make sense. Now we know the muscles, we know why they are supplied by median and ulnar, we know what exactly is supplied by median and ulnar. Now we will know the function so that we can understand the injury. What does the lumbricals muscle do? I want you guys to now put your hand in the writing position. If you want to put your hand in writing position, you have very important 3 joints that you need to talk about. A joint between your metacarpals are here, and these are your phalanges. So the metacarpal and the phalanges joint, we call it metacarpophalangeal joint, MCP. So this is what we call the MCP joint. And then you have a joint between the phalanges themselves, proximal ones and distal ones. We call them interphalangeal joints. Interphalangeal joints. So if you want to put your hand in the writing position, just do it now. Just do it now and tell me, what do you have? I have flexion in the metacarpophalangeal joint, and I have extension in the interphalangeal joint. So if I have that, and the lumbricals muscle is doing that, and the lumbrical is supplied by median and ulnar, and that is keeping my hand in and this is how the lumbricals are coming out of the tendons of profunda muscle, it means if I have a lesion in the median and ulnar nerve, the C8 and T1 roots of lower trunk, these are the 2 roots involved in the clumcus paralysis that affects the median and ulnar nerve in the hand. I'm going to have the opposite. What is the opposite? If the normal is flexion in the MCP, now I will have extension of the MCP. If the normal is to have extension of all of the interphalangeal joints, now I will have flexion in the interphalangeal joints. So clumcus paralysis will cause me claw hand deformity with weak flexors. All right, now do you guys understand why we have this lesion? Now you understand how is the normal, and if I have a problem in them, it means the radial nerve will become stronger than them. So it's gonna do the opposite of what they do. All right. So how can we get Klumpke's paralysis or Klumpke's paralysis? It's during birth also. If the surgeon or a physician or the OB/GYN doctor pull the baby from his upper limb, that can cause injury. And also if someone is holding into something and he is falling down, that can also cause injury to the lower trunk. All right, so with that, you understand why you have claw hands, why it's very important to know it. Because remember, now you guys understand what does the lumbrical do. You guys know that when you put your hand in the way I told you, this is the U letter that is facing your ulna, and this is your M letter that is facing the other side. These are the lumbrical number 1 and 2 in the second finger and second and third fingers. Lumbrical number 1 and 2, they are supplied by median nerve. And this is the part that is supplied by ulnar nerve. So now you understand why, if you have something called ulnar claw hand, it means I have an injury to the ulnar nerve, and that could be in a fracture medial epicondyle. So that will give me ulnar claw hand deformity. It's not gonna give me the claw hand deformity. Now you understand that I have a problem with only the third and fourth lumbricals. That could also be a exam question. Which of the following is a manifestation of injury to third and fourth lumbricals? It is ulnar claw hand. Or which nerve is injured in paralysis of third and fourth lumbricals? We don't want to tell you ulnar claw hand because you will know it's ulnar nerve, but we can tell you third and fourth lumbricals. You know that third and fourth, but ulnar nerve, so that means it's gonna be the ulnar nerve. And now you understand. All right, guys? All right, with that, we are done. Thank you guys for watching, and see you in the next